just showing those locations. So the nasopharyngeal tonsils, also known as adenoids, are found directly posterior to the nasal cavity in the throat, which is called the pharynx. So in the region of the throat that's behind your nasal cavity, that's the nasopharynx. And so these are identified as nasopharyngeal tonsils.
Oh, wait a minute. It says.
And then we have tonsils on either side of the back of the mouth. You can look inside a mirror, and I'll draw a diagram so you'll see where to look. Those are called palatine. And then the back of the tongue itself has tonsillar tissue, and so that is identified as lingual. Okay.
Oh.
Tonsils are unique appearing, so under even low power, may I erase the diagram? Guys okay with that? So under even low power, they can be identified because the surface is thrown into deep folds or crypts. So you can see that here, and while I'm erasing the board, I'll put a larger diagram.
Whoa, girl.
There we go. I think that's right.
So the tonsils have an epithelial surface. They're not completely surrounded by a capsule. So these crypts are going to be formed of an underlying epithelium. Hence, they don't need a capsule on this end. We haven't done the respiratory system yet for the nose or the digestive system. But the nasopharyngeal or adenoid tonsils, being in the nasopharynx, is going to have a pseudostratified columnar epithelium. So the surface epithelium here will be pseudostratified columnar. And both the palatine and lingual tonsils demonstrate the same lining as we have in the mouth, which is non-cornified, non-stratified squamous. Now, deep to this epithelium, we have lymphatic follicles. Right? So I'm just going to draw the circle. The circle, remember, represents a ball of cells, not the capsule around them. So there is no cortex, no medulla. We just have these scattered lymphatic follicles in this tissue. The rest of it would be highly dense bundling, but without being in the spheres. So again, lymphatic follicles. And there is a capsule present on the connective tissue side, on the deep side. And this is where we find efferent lymphatics. So we are going to have a dense, irregular connective tissue capsule. And efferent lymphatics. We don't have afferent lymphatics because this is not filtering lymphatic fluid. It's filtering any bacteria or viruses on the surface of the epithelia, so that you breathe in or that you eat. And if that happens to make its way between the epithelial cells, it'll come in contact with those lymphocytes.
And that's where all three involved.
Is that the tissue that mutates with oral cancer?
Oral cancer can be not any of the lining. It's the non-cornified stratified squamous, but it can be inside the lip or along the cheek area.
I'm like on the side of the tongue. I thought on the back side of the tongue too.
We do have lingual tonsils on the back side of the tongue. So this is not a human tongue, obviously. But here's the muscle of the tongue, the genioglossus, and these two bumps right here are the lingual tonsils. This would be the top of the larynx right here. So if we look at our tongue model, you can feel it if you take your finger, like you're trying to push it down. So it would be this tissue right here. It would be the lingual tonsil. Okay. That is seldom. Anybody here had their tonsils taken out? One? Okay, I had mine taken out when I was 5. Usually those are the palatine or nasopharyngeal tonsils. So my nephew was born about 6 weeks early, and he was always sick. He was like struggling to breathe at night when he fell asleep. He'd have sternal retractions when they're really trying to struggle to pull air into their lungs. And my sister, who was a pediatric heart transplant nurse down at Loma Linda, kept taking him to different pediatricians, and they all said, well, he's too young, he'll grow out of it, you know, there's really nothing we can do. And so she left the country for a trip and left him with her mother-in-law, and came back, and he was sick. And that first night back, she never went to bed. She spent the entire night literally walking the floor with him, because every time he fell asleep, he would stop breathing. And so I said, why didn't you, she took him in the hospital the next morning, which was 2 miles down from their street. I said, why didn't you take him in during the night? She said, I work at that hospital. It's the residents and the interns and the student doctors that are there at night, and I wanted a good doctor. So they put him in intensive care, and 3 days later did surgery to take out his nasopharyngeal or adenoids, another name for the nasopharyngeal adenoids. And he was 6 pounds when he was born, even though he was 6 weeks early. But it took him a long time to grow, and she thinks it's because he was using all his energy just to breathe instead of using it to make new tissue. Another friend of mine had a daughter who only would eat liquid food. She was about 5 years old. She would only eat applesauce or puddings. And they were on a family picnic with a friend who was a rheumatologist, a medical doctor dealing with allergies. And he noticed, they mentioned her behavior. She wouldn't eat carrots or chew sandwiches or anything. And he said, well, have you had her tonsils checked out? And her lingual tonsils were so large that she couldn't swallow anything but liquid. And so one of my students has had their lingual tonsils taken out. And I said, I've never heard of this before. She said she was the first case that her surgeon had actually performed the surgery on. I don't know if I want to be that statistic, but. So tonsils are typically taken out if an individual has an inflammation with these crypts. Bacteria can lodge in the crypts and overwhelm the lymphatic system. So I told you guys about my son who they thought had a pulmonary embolism when he was in college last year. It was misdiagnosed. He actually had a tonsillar abscess. And when we brought him home, we took him to Sutter, this was actually a year ago, March, and they drew off 15, they had to use 2 syringes, and drew off 15 cc's of pus from his right tonsil. And so that was a tonsillar abscess. It was a pocket of basically growing bacteria that was overwhelming the tonsil and wasn't passing through, but just forming a little pocket in one of the crypts. The guy, they had to call in a specialist to come in and do that for him rather than use the ER doctor. She didn't feel comfortable doing it. And the specialist, the ENT guy, recommended that when school was out, he have his tonsils taken out. So I did some research, and as an adult, it's a major surgery. One of my morning students, I'd read it takes 2 to 3 weeks to recover. And she said, yeah, it took her the full 2 weeks to recover. It can be very painful and a difficult recovery. It's not, I remember going home to sleeping in my parents' bed and getting crayons and ice cream. And that's all I really remember about it. It's about a 2 to 3 day thing if you're a young child.
Yeah, me and my mother got it done together at the same time, so we were both down basically. So like
Nobody was there to take care of either.
We were at my grandmother, so she did all that, so I thought it was odd though that we got both wanted to get done at the same time.
It's not commonly done in adults, and Christopher hadn't even had tonsillitis before. So I wasn't comfortable having his tonsils taken out with just one event, but if he has it again in the next 2 or 3 years, then we'll.
I used to get strep throat every year when I was growing up, and my doctor said, the next time you get strep throat this bad, your tonsils are coming out. I never got strep throat again. It was awesome.
Scared him off, huh?
Yep.
So I'm not going to, in our microscope study, I'm not going to have you identify whether it's a nasopharyngeal or, and you're welcome to call them adenoids if you wish, or, spell this right, or
Yeah.
palatine tonsil, but on the models, you need to be able to do that. So you would get partial credit for recognizing it as a tonsil, but if it's on the models, for full credit, you need to identify it by location. I don't know what adenoma refers to epithelial, so I don't know why we use it
But I
in
mean,
that particular
why
term.
did you write it up there? What's
It's another name for
It's another name for
nasopharyngeal.
nasopharyngeal. So they're more common. An adenoidectomy is a tonsillectomy for specifically nasopharyngeal.
Thank you.
So yeah, it's just another name for it, specifically the nasopharyngeal.
I'm just kidding.
Okay, palatine, I said I would illustrate for you how to, so if you look in the mirror, you'll have to open your mouth to do this. So here's the back of your tongue. Here's the uvula, that part of your soft palate that hangs down the back of your throat. And if you look to the side, there are actually 2 muscular folds created by muscles going from your soft palate to your tongue or your soft palate to your throat. And the palatine tonsils are located between those 2 folds. And you can see that on the side view of this head model. So these would be the palatine tonsils there. Because of that connective tissue capsule, it's typically not a difficult surgery. They have special instruments that look like spoons, and they basically just scoop it out and then cauterize the blood vessels. One of my students last semester's niece, her mom had been in the hospital to have a baby, and just before she went to the hospital, her niece had her tonsils removed. And then the mom went to the hospital to have her baby, and the niece started bleeding. She had been given, the mom had given her acetaminophen. And acetaminophen has a slight, it's not like aspirin. It's typically not considered to be a quote-unquote blood thinner. But she had a high susceptibility to it, and she started to bleed and was having a hemorrhaging from her tonsillectomy, and they had to take her back in. And I was really surprised because it's not generally considered, actually she wasn't given acetaminophen, she was given ibuprofen. And that's not, it can have that as a side effect, but it's really, really rare. Okay, so again, no afferent lymphatics, only a partial capsule on its deep surface. So it has an epithelium on its superficial area, superficial surface. And that brings us to the spleen, which we've talked about as we've talked about the splenic vessels. Yes?
So how does fluid get into the tonsils?
Because it's trapped, it's these crypts,
Yeah.
and they're deep, and so it can just get in there and not get flushed out. So it has bacteria. The bacteria can just settle in there, not pass through, but just sit there and grow, and then some of it passes through, and it just
So we don't need them.
forms this.
But it's still on the outside.
Yeah, but if you get a high enough number, then you can get through. They're not like, I don't think a study has shown that if you have, and you usually don't take out all your tonsils, so they may take out just the palatine, or they may take out just the nasopharyngeal. So my youngest son had, well, they couldn't tell whether he had too much air going through his throat or not enough for speaking. He was having trouble with speech, and his soft palate didn't move very well. And so they asked me to bring him in. He was about, not quite 2 years old. And they asked him to swallow this radioactive milkshake. So he's swallowing it, but I'm standing behind an X-ray proof window. And then they took a video, not just slides, but a video of him swallowing to watch the mechanism of it. And they decided that he needed to have his nasopharyngeal tonsils taken out. And after the surgery, he was up running around the room, 2 hours later. But they came to us and they asked if he had been if he snored while he slept, or if he breathed with his mouth open. And we said no, and they were kind of shocked because they said under the anesthesia, his airway was completely obliterated by the size of the tonsils. So it hadn't been affecting his energy or his growth level and stuff, and I don't remember him snoring, so I'm not sure how he worked that. But tonsils are typically not taken out unless they are a problem, whereas the appendix, part of the vault tissue, it doesn't have a capsule, so it's not in the same group as tonsils. Because of the danger of death from a ruptured appendix and the peritonitis that occurs, they'll typically ask permission to take that out if they're going into the abdomen for any other surgery. And while they're there, go ahead and take out the appendix. So, okay, spleen is not blue. All right, if you remember the spleen, looking at the spleen with our cadavers with Tom, it's the same deep purple color as the liver is because of the high number of red blood cells that are there. And the spleen has two functions, one with white blood cells and one with red blood cells. So it's a storage site for red blood cells. We'll talk about that in a moment, but that region of the spleen where the red blood cells are stored has a red color. If you look at a raw spleen and cut it open. And so it's identified as red pulp. The area of the spleen where we have our lymphocytes is identified as white pulp. And it looks lighter in color. It's not just because we have red blood cells and white blood cells present there.
So say that again, the red pulp is what? I'm sorry.
The storage site for red blood cells, so it's outside the blood vessels. And I'll talk about that in just a moment.
And
And the white pulp is where we have our
lymphocytes.
lymphocytes.
Thank you.
So the spleen is a fully encapsulated organ. What color have I been doing my connection? It's a fully encapsulated organ, and it has in its capsule is dense irregular connective tissue. And amongst the collagen fibers, unlike our other capsules, we have present smooth muscle cells. So these smooth muscle cells can contract and increase the pressure within the spleen itself. So capsule, dense irregular. This is again a complete capsule, unlike the partial capsule, plus smooth muscle cells. Now with that smooth muscle increasing the pressure within the spleen, this increases the movement of the stored cells back into the circulatory system. So it's been shown in dogs that when dogs need additional oxygen, the spleen will contract and move additional red blood cells into the cardiovascular system. That hasn't been shown to be a direct relationship in humans. Certainly the spleen contracts and red blood cells are added back to our bloodstream. But they've tried to work with athletes that were exercising and had increased oxygen to see if there was a direct relationship to the oxygen need and specific timing of the splenic contraction. And that wasn't proven, but it does occur. Also, if platelets are needed, the spleen will contract. That has been shown in humans. The spleen will contract and additional platelets and red blood cells will be added back to the cardiovascular system.
Squeezes everything.
You would think so, especially since the platelets are so small. So the splenic artery, the branch off of the celiac trunk, comes into the spleen and sends off multiple branches, and we'll follow one of those. central arteries when they are this small. They actually by structure are arterioles, but anyway, we'll go with the central artery component. And rather than being a sphere, the lymphocytes form a sheath, a column that follows the length of the blood vessel. In the same pattern, so that the blood cells closest to the outside of the cell of the sheath are going to be T lymphocytes, and the blood cells closest to the center are B lymphocytes. So this is identified as a peri-arteriolar, use here they use the word arteriole, lymphatic sheath, and here's another abbreviation, PALS. So periarteriolar lymphatic sheath.
Wow.
Now when this is cut in cross-section, it'll look similar to a lymphatic follicle because it'll be round. But it will have within that round accumulation of lymphocytes the cross-section of a blood vessel. So you'll see that, and if there is a germinal center forming, it's usually not right around the blood vessel, but off sides from that. So this would be, the entire thing would be a cross-section of the PALS. Germinal center. I mean, there are cells there, okay, it's just more lightly colored. And central artery, if you want to go ahead and call it an arteriole, that's actually anatomically more correct, either term. So as the blood is flowing through the spleen, it gets to the arterioles, which have more loose junctions, connections between the epithelial cells. So it's easier for the components, the particles and fluid of the blood to percolate out. And as they do so, they'll come in contact with our B cells and our T cells. This is the only organ that filters not lymphatic fluid, but filters blood. So if somebody, the spleen is, as I said, tucked up high on the left side, under the rib cage, not in the thoracic cavity, but the diaphragm goes up high. And so in automobile accidents or any accidents which the ribs are broken, on the left side, the spleen is easily lacerated. And the spleen is an organ, because it's all basically reticular tissues and blood vessels and blood cells, it's hard to repair. It's easily fragmented. The term I use for that is friable. If you take wet clay, it's packed together, but if it's dry, it breaks apart easily. All right, and that's the way the spleen is once it's torn open. So surgeons may decide that it's going to be too difficult to repair and keep its integrity in place and just elect to remove the spleen. Or if someone has liver disease and the blood pressure backs up the splenic vein into the spleen and causes it to be too large and they're afraid it's going to rupture, they may go in and take it out before it ruptures. So with the lack of the PALS, you're going to lose the ability, the only organ that filters blood for any blood-borne pathogens. Let's say that you have your spleen removed and you go and get dental work done. Maybe you're going to get your teeth cleaned or a cavity filled. And if you bleed easily with those procedures, or even if you don't have a spleen, they're going to provide or ask you to take prophylactic antibiotics prior to that procedure, just in case something happens to get into your bloodstream with the open vascular tissue. Okay? So there is that higher risk without the spleen. Now, that's the white pulp. All right, so wherever we see the periarteriolar lymphatic sheath, this is what provides the white pulp. The rest of the blood vessels then start to lose their tunica adventitia. The epithelial tissue and the smooth muscle tissue becomes oriented along the blood vessel in a longitudinal fashion rather than in a circular fashion, similar to the staves of a wine barrel, and their gaps appear between those cells. And it's at those sites that the red blood cells, of course white blood cells too, but they're mostly red blood cells, can leave the blood vessels and enter into the surrounding storage tissue, which also still has reticular fibers. So all the red blood cells out here are identified, or contain the red pulp. All right?
Are those capillaries or still arterial?
They're still, they're arterioles. There can be capillaries as well, but they are arterioles. So let me switch over to
In the white coat, there's not very many B cells, is there?
it's, well, in the center of those arterioles would be the B cells. Well, that's the central artery. That's the blood vessel.
When the B cells were.
Yeah. Well, the B cells are forming this germinal center. Yeah. So here's a slide of spleen. So this would be part of the capsule. Again, another trabeculae, but it's not divided up into quite as many segments. And in this is stained tissue, not a raw spleen. So the blue areas that you're seeing are the white pulp. And it looks like a follicle, right?
Yes.
But that's because we're seeing it in cross-section. And you can see some of the blood vessels that are associated with these sheaths. And all the rest of this would be red pulp. So if I think the next slide will have that a little bit larger. So this is the central artery or arteriole, all right? And here's a germinal center showing. This one is just the germinal center is way over here. The T cells would be out here in the periphery. And again, the central artery is not in the center always of the periarteriolar sheath. So here's red pulp. Here's the periarteriolar sheath with the blood vessel, the central artery. Okay, here's another blood vessel. Here's another blood vessel.
So the red pulp
So this one is the
more
spleen.
variants in the darkest of stainings.
Right.
Maybe white, purple, pink, and then.
So the presence of that vessel tells you that you're looking at the spleen. Obviously, the spleen does not have medullary pores, and it's not going to have medullary sinuses either. It's not even going to have subcapsular
So the
sinuses.
whole thing.
Yes, the red blood cells are supported by reticular tissue as well.
I guess just kind of looked like a cord.
Yeah,
No one
you didn't know they were red blood cells.
Yeah.
Is there always a germinal center?
Frequently, but that only means that it's been exposed to some antigen. So no, there doesn't have to be a germinal center. This one down here, this doesn't have one. This one doesn't have one.
Oh, those are
Maybe it's
germinal
starting to
centers?
get one or
It's not the central
outside.
artery?
The light color, the light portion that's inside the dark purple, that would be the central, the germinal part.
But
Okay,
this
so
right
here are
is the other
characteristics.
artery. Yeah, okay.
Of the spleen. So it has a complete capsule like a lymph node does, but unlike a lymph node, that capsule is going to contain smooth muscle. Again, no afferent lymphatics. There are efferent, because any organ's going to have that. Anytime we have capillaries, we are going to pick up extra tissue, but it's not the important function. Now, with the lack of the red pulp, so we talked about having a splenectomy, taking the spleen out. So with all those stored red blood cells, another symptom is fatigue, because we lack those red blood cells that can be added back to the circulation, and of course their function is to transport oxygen. So the lack of the pals is going to provide a greater susceptibility to blood infections. The lack of the red pulp, not having red blood cells, fatigue. What would bruising indicate? Loss of not red blood cells. Why do we bruise? Remember that picture I showed you of the hemophiliac that had the platelets?
Anemia. Oh, platelets.
So these be either clotting factors or platelets that you don't have enough of would provide the easy bruising.
So if
Okay.
you had a split, I mean, blood doping would probably help
Yeah, probably see a great effect from that. All right, before break, the last organ I want to talk about is the thymus. And again, we will talk about its mechanism of function on Thursday. We talked about the thymus already with it's an endocrine organ. And the hormone it makes is called thymosin, big surprise. Its greatest size and function is in childhood. So you get to reach 13, 14, 15. And the epithelial cells that form this organ start to die, and adipocytes take their place. So you might still see some fatty structure over the heart, but if you look at it microscopically, you're not going to see the thymus cells. It functions as a site for the maturation of T lymphocytes. So the stem cells for our lymphocytes are in the bone marrow. The B lymphocytes stay there to become mature B lymphocytes before they get into the bloodstream. But the T lymphocytes leave, and they end up finding a nest in the thymus. Anywhere else, they're going to die off. They get to the thymus and they settle in there, and they undergo a process which selects them. We don't want T cells that can't even recognize a foreign antigen. But we don't want them recognizing the markers on our cells and attacking us. So they have to answer two questions. It says yes or no selectivity. And if they fail either question or both, they commit cell suicide, apoptosis. And yes, the triggers generally some mechanism through the mitochondria, and they die. So that we're left with a population throughout adult life with T cells that hopefully will not change, but will not recognize us, and they recognize foreign cells. The only cell that we made that they should recognize is a tumor cell, which has mutated genes and is producing proteins that our cells normally don't make. That would make it foreign to a T cell, a transplanted cell. A cell that's infected by a virus, and now it's making viral proteins. Would be making proteins no longer recognized as cell. So we'll look at that process on Thursday. This is showing the thymus in a cat. The heart would be down in the lower area. And the thymus, you may have seen it in the microscope at the earliest semester. It does have a cortex. It has these tiny lobules. Each lobule has a cortex in a lighter area, which is the medulla. Thymuses do not have B lymphocytes. They do not have lymphatic follicles. All right, they're not functioning to filter anything. They're an isolated, protected site in which T lymphocytes are presented with your self-antigens and then decide whether they react to them or not. So these are lymphocytes, are also epithelial cells. It's not known why, but some of the epithelial cells form this concretion. They kind of wrap around each other tightly, known as a Hassel's corpuscle. Histologists, people who study tissues, love them because it helps you identify a thymus as a thymus, even if it's full of adipose tissue. You see that structure there, which is just epithelial cells wrapped around each other tightly, then it's a thymus. All right, so we're going to stop there. We'll pick up how the thymus works when we talk about T cells and those steps, questions it has to answer. So why don't you guys take a break, and we'll start the blood identification lab, looking in the microscope at blood cells at 1. And then if you guys are comfortable with it, we took the quiz about 55 minutes, 60 minutes later this morning, so an hour